Dozens of state leaders, doctors, and public advocates packed a meeting room today, warning what a proposed near total abortion ban could mean for patients and providers here in the Palmetto State. Thanks so much for joining us tonight. I'm Justin Kolar.
And I'm Samantha German. The bill is called the Unborn Child Protection Act. The discussion hosted by Americans for Contraception at the Charleston County Democratic Party headquarters.
This comes just days after the Senate Medical Affairs Committee advanced the measure to the full Senate.
Live 5's Maya Brown has more on the meeting and what was discussed for what would be the country's strictest abortion ban yet.
Bill 1095 changes the terms of abortion in the state of South Carolina from a 6-week ban to as soon as a pregnancy is clinically diagnosed, or in other words, 6 days after contraception. This new advancement of the bill in a 8-4 vote has local leaders and health professionals worried about the future of women's health. Hosted by Americans for Contraception at the Charleston County Democratic Party headquarters, the meeting discussed the implications of Bill S-1095, also known as the Unborn Child Protection Act, a near-total abortion ban that was advanced earlier this week.
In states that have already passed similar laws, I have watched women sent home to wait and come back in septic shock. Some of them did not survive. Those are not hypothetical women. I could tell you many stories of various things.
Stories of pain and struggle. That's what dozens of state leaders and health officials shared at a meeting highlighting potential impacts of the proposed bill that would remove exceptions for abortion like rape, incest, and fetal anomaly. A decision doctors say could have direct impacts, especially in rural communities in the Low Country.
And when you force women to carry high-risk pregnancies, when you do nothing to address the maternity health care deserts here in South Carolina, where we currently have 14 counties without a single OBGYN, and where doctors are actively fleeing the state for fear of going to jail for delivering evidence-based care, moms and babies will suffer and die.
In terms of punishment, there would be established criminal penalties for both providers who aid in abortions and for patients who receive them. A penalty of up to 20 years for providers.
We're going to lose medical professionals. We're already losing them to North Carolina and Georgia because they don't feel safe here. We have rural communities that don't even have OBGYNs or practitioners in that field because it's already a sacrifice to be there in those communities, yet we're putting more restrictions on them. It makes absolutely no sense.
While opponents of the bill spoke at the meeting, there are proponents that say it protects innocent lives and moral values. After passing through the Senate Medical Affairs Committee, the bill is now set to advance to the state Senate floor in the coming weeks. For Live 5 News, Maya Brown.